Welcome to the Healthcare Authority presentation focusing on Washington Apple Health Medicaid restoration for COFA Islanders. In this presentation, we will cover the following topics: Compact of Free Association or COFA background, Apple Health Medicaid restoration, Apple Health overview, eligibility factors, Apple Health for parents and caretaker relatives, Apple Health next steps, client responsibility, post-transition, scenarios, how to apply, and resources. COFA background. COFA stands for Compact of Free Association, which is an economic and military treaty between the United States and 3 Pacific Island nations. Washington State has the second largest population of Cosarians and the third largest population of Palauans and Marshallese people in the U.S. While the region is called Micronesia and includes many island nations, the compact is between the Republic of Palau, the Republic of Marshall Islands, and the Federated States of Micronesia, which includes the states of Yap, Coxsackie, Chuuk, and Pohnpei. The 6 main languages of COFA are Chuukese, Coxsackie, Marshallese, Palauan, Pohnpeian, and Yapese. COFA Islander healthcare began in January 2019, and a dental benefit was added, creating the COFA Islander dental care. The plan year 2021 is the 3rd plan year since COFA Islander healthcare was created. These programs provide premium payment and cost-sharing assistance for COFA Islanders living in Washington, enroll in a qualified health plan or qualified dental plan. Apple Health restoration. Medicaid has been restored under Section 208 of the Consolidated Appropriations Act of 2021 for individuals from the Republic of Palau, the Federated States of Micronesia, and the Republic of Marshall Islands. COFA Islanders were limited in their ability to receive Apple Health prior Medicaid restoration, although children and pregnant individuals were and continue to be eligible for Apple Health. We are updating our eligibility system to allow COFA Islanders to receive Medicaid as qualified non-U.S. citizens exempt from the 5-year bar. The restoration does not create a COFA Islander Apple Health program. Eligible individuals will enroll in existing programs. When an eligible COFA Islander submits their Washington Health Plan Finder application and meets all Apple Health eligibility criteria, they will receive an Apple Health approval and a COFA Islander healthcare denial. The system rules will update to allow for correct Magi and non-Magi Apple Health eligibility. COFA Islander healthcare enrollees under age 65 without Medicare will transition to Apple Health for adults on July 1st. Their COFA Islander programs and qualified health plan will end June 30th. COFA Islander healthcare enrollees age 65 and older, or those with Medicare, must apply for Apple Health through Washington Connection with the Department of Social and Health Services. They will remain on COFA Islander programs until the eligibility determination is complete. The cost-sharing card, also known as the Navia card, COFA card, or debit card, remains active for 3 months after the COFA Islander healthcare ends. It may be used for outstanding bills for services an individual received when enrolled on COFA Islander healthcare. If an individual is active on COFA Islander healthcare, their card remains active. This timeline displays that system updates will be implemented by June 20th. Anybody who is brand new to Apple Health can submit an application, and if approved, their coverage will start June 1st. The system will redetermine eligibility on July 1st for an effective date of July 1st for those currently enrolled in COFA Islander Healthcare. An application is required to determine if an individual is eligible for Apple Health. COFA Islanders must meet all eligibility requirements to qualify for Apple Health programs. COFA Islanders are encouraged to update their Washington Helpline Finder applications if they were previously denied or terminated. Eligibility criteria between COFA Islander programs and Apple Health differ. For example, individuals may be eligible for Apple Health even if they were offered insurance by their employer or they do not intend to file taxes. To prepare for this transition, COFA Islanders can ensure their Washington Helpline Finder is up to date, including addresses, household members, and income. Submit a new application in Washington Helpline Finder or Washington Connection, designate an authorized representative, or check with their providers to see which managed care plans they accept. Apple Health Overview. Apple Health provides healthcare services for different populations, included but not limited to low-income families, adults, and pregnant individuals. Most individuals eligible for Apple Health apply for coverage online at helplinefinder.org. These Apple Health programs are referred to as Modified Adjusted Gross Income or MAGI-based medical programs. Income limits, household size, and residency are used to determine eligibility. Programs administered by the Department of Social and Health Services are referred to non-MAGI Apple Health. Individuals who are age 65 years or older, have a blindness or a disability, or need long-term services and supports can apply for Apple Health coverage by submitting an application online at washingtonconnection.org or a paper application. Eligibility criteria for each program is based on household size, income, and resources. Typically, individuals who are approved for Apple Health are certified for a one-year period unless they are no longer a Washington resident, or they no longer meet the specific program eligibility criteria, or they are turning 19 years old, or found ineligible during a post-eligibility review. Individuals who are incarcerated or committed to a state hospital will have their benefits suspended rather than terminated. Eligibility factors. Apple Health eligibility criteria changes between programs. For example, requirements for Apple Health for adults include age, income limits, and Medicare eligibility. Let's take a look to other eligibility factors. Individuals applying for Apple Health are required to provide a date of birth and Social Security number. Washington Helpline Finder uses electronic cross-matches to verify the information provided. When the information does not federally verify, individuals receive an information request letter and eligibility staff review the case and attempt to manually verify the Social Security number. Individuals should send proof from the Social Security Administration when an application for the Social Security number has been submitted, and their Social Security number when it is received. Apple Health is not denied or terminated while waiting for the Social Security Administration to send a Social Security number. Individuals who are required to provide a Social Security number or proof of a Social Security number application but refuse to do so will not receive Apple Health coverage unless they are not able to obtain or provide a Social Security number because they are a victim of domestic violence, are not eligible to receive a Social Security number, or may only be issued a Social Security number for a valid non-work reason, or refuse to apply for or provide a Social Security number for well-established religious objections. Apple Health programs are limited to Washington residents. A resident is someone who currently lives in Washington state and intends to continue living in Washington permanently, or enter the state looking for a job or with a job commitment. An individual does not need to live in the state for a specific period of time before being considered a resident. In addition to the previous slide, a child age 18 or younger is a resident when the child lives within the state even without a fixed address, with a parent or caretaker who is also considered a resident, the child's parent or caretaker is a resident, or the child is age 13 or older and can attest to their own residency. An individual can be temporarily out of the state for more than 1 month and still be considered a resident if they intend to return to the state once the purpose of the absence has been accomplished and are not determined eligible for Medicaid in another state. Apple Health for parents and caretaker relatives. Adults who care for a minor child may qualify for the program called Apple Health for parents and caretaker relatives. Eligibility is based on household income and citizenship and/or immigration status. If a parent or caretaker relative is over income for this program, they may still qualify for Washington Apple Health for adults. Apple Health Medicaid extension for parents and caretaker relatives is given only to parent and caretaker adults who become ineligible for Apple Health parent and caretaker relative coverage due to an increase in earned income or spousal support. The adult must be eligible for Apple Health for parent and caretaker relatives coverage in 3 of the preceding 6 months to qualify for this program. Keep in mind that Apple Health extension have a 12-month certified period. However, eligibility is not continuous, and changes in household circumstances may affect eligibility. Apple Health next steps. Once an individual is found eligible for Apple Health coverage, they will receive a letter in the mail that shares a link to their Welcome to Washington Apple Health Benefits and Services booklet. This booklet displays important information regarding how to use their Apple Health coverage. The client's Apple Health plan will also send plan-specific information that should be kept handy for future reference. Keep in mind that if a COFA Islander had Apple Health in the past, they will not receive a new Provider One services card, since the old one will still be valid. The Provider One client number is needed to receive health services. Each person in the household enrolled in Apple Health will have their own services card. Replacements may be requested only at providerone.org/client. The services card is used for adult dental and vision benefits. These benefits are not paid for by their MCO. The process of Medicaid plan selection is the enrollment in a managed care plan after an individual is determined eligible for Apple Health coverage. The system will determine whether an individual can enroll in a managed care plan. Once individuals are found eligible for Apple Health coverage, they can proceed to select a managed care plan or skip plan selection in Washington Health Plan Finder. When an individual is newly eligible for Apple Health and enrolls in a managed care plan, the managed care is effective the first of the current month. Individuals approved for non-Magi Apple Health through DHHS will receive a notice of enrollment in a health plan and instructions on how to change plans, and their enrollment handbook with information about Apple Health and managed care. Once COFA Islanders are enrolled in a managed care plan, their MCO will contact them with some initial health questions. It is crucial that these questions are answered so the MCO can assist individuals with coordination of their necessary health services. Guaranteed access to primary care, broad networks of specialty providers, care coordination, and health homes are some managed care benefits. Apple Health offers integrated managed care plans in all regions statewide. Integrated managed care coordinates physical health, mental health, and substance use disorder treatment services to help provide whole person care under one health plan. For high-risk individuals with chronic conditions, the MCO will coordinate care management, health education services, and services between systems. Some services may require a referral from the enrollee's primary care provider, or PCP. These services may require a prior authorization from the MCO so that the service can be paid for. Individuals may contact their MCO for help or for any questions they may have. These are many ways an individual can change their plan. They can call the healthcare authority or self-serve through the Provider One portal, the Washington Health Plan Finder website, or mobile app. The changes will be effective the following month. Once an individual logs into their Washington Health Plan Finder account, they can view or change their Apple Health managed care plans by selecting Shop for Current Plans on their dashboard under the Household Coverage Summary. The plans available in their county will display. Individuals can select their plan by clicking Pick this plan, highlighted in green. Client responsibility. Individuals approved for Apple Health are required to report changes within 30 days. Some change of circumstances include, but are not limited to, residential or mailing address, marital status, or pregnancy. Renewal of Apple Health eligibility is required at least every 12 months, except for Apple Health medically needed spend down, pregnancy medical, or individuals turning 65 within the next 12 months. When can an individual renew coverage? An individual can renew coverage 60 days prior to the end of their certification period or up to 90 days after the coverage has ended. If an eligible individual submits a completed renewal within 90 days after coverage closed, Apple Health will be restored without a gap in coverage. If a renewal is not received, a termination notice is sent 20 days before the end of the certification period. Post-transition. Something to keep in mind is that resources are countable for non-Magi programs. Some examples of resources are savings accounts, burial plots, and houses. COFA Islander Healthcare and COFA Islander Dental Care will remain as an option for individuals who are over-resourced for all Apple Health programs. Individuals must meet eligibility requirements for COFA Islander programs, including filing taxes and meeting income limits. Let's apply what we have learned to some scenarios. Scenario 1. Julie had COFA Islander Healthcare until July 1st when she transitioned to Apple Health. She goes to the pharmacy on July 16th to get her prescriptions. What information does she provide? Since Julie has Apple Health beginning in July, she will provide her managed care card and Provider One services card, or tell her pharmacist she has Apple Health. Scenario 2. Julie had COFA Islander healthcare until June 30th. On July 10th, she received a bill for her January hospital stay. Can she use her Apple Health to cover this bill? No. Julie had COFA Islander healthcare in January. Her COFA card is active until September 30th. Once she confirms her insurance plan paid their part, she uses her COFA card to pay the balance. Scenario 3. George moved to Washington in July 2021 and wants healthcare coverage. He is 49, does not have Medicare, and is not working. His cousin told him about COFA Islander healthcare, and on August 25th, he submits his Washington Helpline Finder application. What is the outcome of this scenario? George is eligible for Apple Health. Since he applied in August, his coverage will begin August 1st. Scenario 4. George is enrolled in Apple Health and needs help with his medical care. His plan calls him to complete a healthcare screening, and he tells them he is diabetic, needs his medicine, and help finding a doctor. What is the outcome of this scenario? His managed care plan will assist him with finding a primary care provider and provides the phone number. He makes an appointment, and his PCP prescribes him medicine covered by Apple Health. Scenario 5. Rebecca has COFA Islander healthcare and her children have Apple Health. She transitions to Apple Health on July 1st. What managed care plan will she have when she enrolls in Apple Health? She will have the same managed care plan as her children. She will need to ask her doctors if they accept Apple Health and the plan her family has. Scenario 6. Rebecca's spouse, Steve, had employer-sponsored insurance and could not get COFA Islander healthcare. Is Steve eligible for Apple Health? He may be eligible if he meets other requirements such as income and residency. Having other insurance does not disqualify adults from Apple Health. Scenario 7. Danny had Alien Emergency Medical or AEM because he is on dialysis. He is concerned that he will have to pay for his treatments when he transitions to Apple Health. Will Danny have to pay for his treatments? Apple Health services include dialysis. Danny provides his new managed care card to the dialysis center so that they have the most current insurance information. Scenario 8. Sam is 72 and applied for Apple Health with DHS. His monthly income of $342 is from Social Security, and he has $2,800 in savings. He is denied non-MAJA Apple Health because he has too many resources. The resource limit is $2,000. How can Sam have healthcare coverage? Sam may be eligible for COFA Islander healthcare. He can apply through Washington Helpline Finder. Scenario 9. Mary is 57, has Medicare and $897 SSA income. She needs help with her premium and heard that there may be an Apple Health program that can help. Where does Mary apply for Apple Health? Mary applies for Apple Health through the Department of Social and Health Services. She's approved for Medicare Savings Program and has her Part A and Part B premiums, deductibles, and co-payments covered. Scenario 10. Julie is 27 and works at the casino making $4,000 per month. She applied for Apple Health because she heard it was restored for COFA Islanders. What is the outcome of this scenario? Julie is not eligible for Apple Health because she is over the income limit. While Apple Health has been restored to COFA Islanders, they must meet all eligibility requirements. Julie may purchase a health plan on the exchange. How to apply? Most individuals applying for Apple Health coverage apply for a MAJA-based medical program. Applications for these programs can be submitted online at wahelplandfinder.org, over the phone, using the mobile app, or by fax or mail. Eligibility criteria changes for each program and is based on household size and income, not resources. Staff at DHHS determine eligibility for Apple Health programs for individuals who are 65 years or older, or have blindness or a disability, or need long-term services and supports. Applications for these programs can be submitted online at www.washingtonconnection.org, by mail or fax using a paper application, in person by visiting a local community services office, or by phone. Resources. For more resources and training materials regarding Apple Health and the use of Washington Health Plan Finder, please visit the Healthcare Authority Stakeholder Training and Education webpage. For more information on COFA programs, please visit www.hca.wa.gov/COFA. Healthcare Authority has dedicated emails for different topics and is here to help with any questions you may have.